Hershey Medical Center. This is Ask Us Anything About Surgical Weight Loss. I'm Scott Gilbert. You've probably heard the statistics. An alarming 160 million Americans, if not more, are categorized as either overweight or obese. That raises the obvious question, what can be done to try to reverse this problem? For some, diet and exercise may be the best option. For others, surgical weight loss may be the best option. Here today to talk with us about that is Dr. Ann Rogers. She is director of Penn State Surgical Weight Loss. Thanks for being here today.
It's great to be here. Thank you.
So some people watching might be asking that question that I'm sure you get all the time. How do I know if surgical weight loss is for me? What are some of the things that make someone a good candidate?
So a lot of people feel alone in the world, but they're not. 5% of all humans qualify for surgical weight loss. We tell by body mass index, which is a comparison of height and weight. In simple terms, if you weigh approximately 100 pounds more than you should, you would qualify.
And when it comes to diet and exercise, I mentioned before, those are options for some people, but how do you know whether you've done that long enough and need to explore another option?
Well, all of our patients have tried every kind of diet in the world prior to coming to our program, so many of our patients have been dieting since they were little children. Most people want to try diet and exercise first, and eating right and exercising are important even if you're going to have surgery, but it's reasonable to try that first.
And in terms of the demographics of people having surgery, it's not just for adults. There are some adolescents for whom it's a good choice.
Absolutely. We're one of the few accredited adolescent weight loss centers in the state. So we accept patients who are of adult size starting around age 15.
You're watching Ask Us Anything About Surgical Weight Loss from Penn State Health. I'm Scott Gilbert, along with Dr. Ann Rogers. And we welcome your questions and comments. You can enter them right in the comment field below this Facebook post, and we'll pose them to Dr. Rogers. Whether you're watching this live or even if you're watching it on playback, we'll make sure we get an answer for you. From the time they first express interest, what then happens? What's that series of events that happens in terms of screening somebody and making sure that they are a good candidate?
So we have live information seminars that patients can attend, given by a surgeon, and they can ask their questions and learn about the program and what we do. We also have an online seminar that patients can visit to view anytime, take a little short quiz to show that they watched it, and then there's some paperwork we ask patients to submit, 1 or 2 pages, and once we've had a chance to look over the paperwork, we call patients and get them right into the program. The program consists of visits with our dietitians to get nutritional education. There's also a visit with our psychologists, some testing and evaluation to make sure patients are safe and stable. And then how long they remain in the program is mostly driven by insurance. Some insurers require 3 months and others require 6.
Dr. Rogers mentioned a video. We'll post that link along with this Facebook post. And also for more information, the number to call about those seminars is 717-531-7260. Again, that's 717-531-7260. There are various types of bariatric surgery and procedures that can be done. Can you walk me through those?
Sure. The procedure almost everybody has heard of is the gastric bypass. At one time, that was the most common operation for weight. Currently, the most common operation in the whole world is something called sleeve gastrectomy, and that's most of what we do. We still do the gastric bypass, and we're one of the few centers in the state that offers something called the duodenal switch procedure.
So 3 different procedures. How do you determine which one is for an individual patient?
Well, we ask patients to listen and learn about all the kinds of procedures while they're in the program, and then when they meet with the surgeon, based on their medical issues and their lifestyle, we agree together on what would be the best option for them.
And given that it's not perhaps as common as the others, can you explain duodenal switch and what that involves?
The duodenal switch includes having a sleeve gastrectomy where you make a narrow tube out of the stomach and remove the big stretchy part, and then it also includes a bypass of the intestines. So it's really the only operation we have that can help really big folks get to an ideal body weight, but it's really intended for people in the higher ranges of body mass index.
You're watching Ask Us Anything About Surgical Weight Loss from Penn State Health. This is Dr. Ann Rogers, Director of the Penn State Surgical Weight Loss Program, and she welcomes your questions here again, whether you're watching this live or on playback. And of course, we encourage you to share this information too. Share this post if you find this information helpful, as you hopefully do. One of the questions I'm sure you get from a lot of patients up front is, well, obviously I have a certain target weight I'd love to get down to, but how much weight will I lose with this procedure?
So we tell people on average with common operations like the sleeve or the bypass, they're likely to lose about a third of their weight. Some people lose more, some may lose a little less. In some ways it has to do with how you use the procedure, whether you're eating right and exercising, whether you still have a metabolic rate and you can still burn calories, things like that.
I was going to ask you about that after the procedure. How important is it that people take care of themselves after the procedure and don't just expect the surgery to solve all their problems?
Yeah. The surgery is in no way magic, and it's really not the easy way out. And some people tell our patients they're taking the easy way out. It's not. It's a total lifestyle change, and if they don't incorporate eating right and exercising, the operation won't be as effective.
And is that part of that screening beforehand to see what the likelihood is that they'll stick with that program after the fact?
To some extent, yeah. We educate patients as much as possible about how important their own lifestyle changes are going to be.
It's a pretty major procedure, any of the ones you mentioned. So as with any surgery, there's a risk of complications. Can you talk about how you try to mitigate those?
Well, the great thing is that since about the year 2000, most bariatric procedures have been done laparoscopically, meaning through very small incisions. So since that changeover, it's gotten to be extremely safe. In fact, the complication rate of bariatric surgery is lower than that of things like hernia and gallbladder surgery. So the old horror stories people used to tell just are not true anymore.
You're watching Ask Us Anything About Surgical Weight Loss from Penn State Health. I'm Scott Gilbert alongside Dr. Ann Rogers. She's Director of Penn State Surgical Weight Loss. You know, I was reading in the news that there was a study out of Cleveland Clinic recently that explored the benefits of surgical weight loss, specifically those who have uncontrolled diabetes. Any surprise there on how it's not just, it didn't just seem to have improvements in their weight, but also in dealing with a very serious disease?
Well, there was no surprise for me, but I think there were many surprises for the general public and for a lot of our internal medicine doctors to see that this is not just a valid option for the treatment of diabetes, it may be a preferred option for a lot of patients with diabetes. And the study basically showed that gastric bypass and sleeve gastrectomy were both far more effective at reversing or at least controlling diabetes compared to intensive medical management.
So those conditions brought on by weight. And there's some other conditions it helps with too, correct?
Many, many. A lot of those weight-associated conditions like sleep apnea, high blood pressure, high cholesterol, joint pains. There are many weight-associated problems that tend to get better after the surgery.
You've been watching Ask Us Anything About Surgical Weight Loss from Penn State Health. Again, we encourage you to share this post on your Facebook page. Help us get the word out about this good information. And of course, whether you're watching it now or on playback, you can ask your questions and we'll make sure we get some answers for you. And make sure you follow our Facebook page, the Milton S. Hershey Medical Center Facebook page, so you can get notifications about future editions of Ask Us Anything About. Thank you very much for watching Ask Us Anything About Surgical Weight Loss from Penn State Health.